Good evening, Littleton. This is the Board of Health for the July 23rd, 2025 meeting. In attendance from the board, we have Kevin Davis, Matt Wason, Kevin Baker, Francis, Heidi, and Susan. Okay, let's get started. Our first agenda item is a public hearing at 7 p.m. for 18 Pleasant Street. If the people representing 18 Pleasant Street could raise their hands, we'll promote you.
Hey, everybody. My name is Montgomery Ustemski and McNary at 1000 Main Street, Acton. I'm going to be representing the applicant tonight. I'm going to share my screen.
That sounds great.
So this is 18 Pleasant Street. So for the existing conditions, they have an existing house, a deck, and a shed here in the back. They do have this existing driveway. This is the edge of the existing driveway. They do have wetlands in the back. As you can see, this BVW in the blue that offsets the 100-foot buffer zone into the property. They have an existing septic tank. It's within the 50-foot buffer zone. So what we're proposing here is to install a new septic system. So a new septic tank, a new pump chamber, and a new leach field. Because of the restrictions that we have on the property, it's very small. This is the best place we can put the leach field and have the proper drainage and the proper cover needed for the system to function properly. So we did place the leach field over here, so you can see almost half of it's going to be underneath the driveway, and we're showing a proposed grade on top of the leach field, which slopes down onto this side. As you can see, it's going to be a swell directing the water here to the back of the property.
So I need to interrupt real quick.
Yes.
Is anybody else seeing the share? Because I'm not seeing the share.
Are you seeing it?
am. Yeah, the plan, Kevin?
Yes.
Yeah, I can see it.
Okay, keep going.
Okay. All right. Oh yes. So yeah. So most of the properties within actually the 100-foot buffer zone. We did have a meeting with conservation yesterday, and they requested us to locate any trees that may be coming out and just put them on the plan. So that was the biggest thing that they discussed with us. For this septic tank that's existing, we're just gonna pump it dry, then rupture it, and then fill it with sand and leave it in place. So this existing septic tank is going to stay in place. And we do have this silt barrier to protect the wetlands, but that's for conservation. So basically, that's the scope of the project. I'll take any questions from the commission right now. From the board. Sorry.
Mr. Wason.
Do you want me to kind of run through it real quick?
Yes, actually, yes, Francis, please run through it.
Sure. So soil testing was conducted in the front and the back. As you can tell, there wasn't enough room in the front, so that's why it is being sited in the back. It's a small lot, as he mentioned, and the wetlands are pretty significant in the backyard. So this is really the only place they could put it. The reduction of the groundwater offset for the leaching area will minimize the height of the mounded area in the backyard. That is key because it will prevent runoff into the abutting property, especially to the left at 14 Pleasant. And of course, the fill needs to come to breakout for the leaching area, so it's going to extend to 10 feet based on where it is and location. So it's probably the best location, and the swale also adds another element that will prevent any runoff as well.
Okay, thank you, Francis. Dr. Wason.
Okay, just for everybody's sake, Montgomery, could you tell us the exact things you're asking for this board to rule on?
I think there's a waiver, if I'm not mistaken, for because I think fill within 10 feet from the lot lines is not allowed. Um, so we're asking for, if I'm not mistaken, a waiver to that. So
Okay.
right now, I think we're a minimum of like 2 feet away here, which is very close to the line. So we're going to be grading and filling within the 10 feet from the property line on adjacent to 14 Pleasant Street. Yeah, basically that's it.
So he's requesting a reduction of the groundwater offset as well
Yes.
for the leaching area from
Oh, yeah.
5 feet to 3 feet, which is allowed under the pre-approval of the Presby system. And like he said, placement of fill within 10 feet of the lot line.
Okay. And then, yeah, it's obviously a tight line. And those dark lines running vertically, those are the lot lines. Is that correct?
Mm-hmm. Yeah. This is a
Okay.
lot line. It's 14.
And then the whole system's between the 50-foot and 100-foot buffer zone, it looks like.
Mm-hmm.
Okay. And yeah, there's no room on the right side, obviously, because that lot line is so close and you have a shed to deal with. So
Yeah.
I see what's going on there. In your opinion, any problems with that ending up under the driveway? Is the driveway going to have to be elevated from what it currently is?
Yeah, a little bit because we're changing the grade.
Yeah.
So it's gonna come up a little bit, like this portion, because we're gonna be increasing the cover over, because you need 18 inches minimum if the system is gonna be underneath a driveway. So we have to raise the grade a little bit.
Okay.
For that.
But it looks like the house is kind of at the peak of the grade of the property already. It looks like front to back and in the westerly direction on the drawing.
Yeah, so the grades are going to be tying back into the existing. So yeah.
Okay. I don't believe I have any further questions at this time.
Mr. Baker.
I'm just curious why you're not asking for 2-foot groundwater offset.
2. I think you mentioned it already, right? We're asking for that as well.
You're going for 3 feet.
No, so was it so the perk test where's my data? So the perk test showed that it was less than
2 minutes.
yeah, so basically you would need like 5 feet from the groundwater to the leach field, but then once you do that 2-foot reduction, it brings you down to 3 feet.
So the perk was too fast.
Yes.
Okay, thank you.
So that's why we did reduce it to 2 feet, but because of the 5, yeah.
Okay. No other questions. Thank you.
Okie dokie. Myself, I'm looking at the drawing and I'm looking for the variances that you're actually asking for, or the exceptions or the waivers that you're asking for.
Mm-hmm.
They're usually spelled out on the prints themselves, and I don't see them. Maybe I'm just missing them at the moment.
On the plan?
Yes.
So we do have it here.
Okay.
This is for the fill within the 10 feet to the lot line.
Uh-huh. Yep. And then weren't we? Go ahead.
And the other one is not on the plan. But we can add that if there's something that's required.
Yeah. Yeah, that's a tradition that we usually have with the board, is the each of the waivers that you're asking for are included on the plans. So that way it creates a complete package on the plan. So that way when people go to pull it, all the information is there. Just a quick question. I don't recall, maybe I'm misremembering something here. Having a driveway over top of the leach field, is that a no-no? Francis, or is that okay?
It depends on the weight calculation, but typically no.
Okay. So
Yeah.
how are we going to protect the leach field where, in this case, with a driveway over on top of it and cars parking on it and snow load, all that kind of good stuff?
Okay, I think Kevin raised his hand.
Mr. Chair,
Yeah, sorry, go ahead, Kevin.
I think they just need to make sure they use the Schedule 40 pipe.
Oh, was that? I thought it was I thought this was a special, like a Presby system or something like that. Or am I?
Yeah,
Am
it's a
I off?
Presby system. So usually,
Yeah.
if it's not underneath the driveway, you would need 7 inches minimum over the system. But if you're putting it underneath the driveway, then you need 18 inches minimum. So it does. We are providing enough cover over the leach field, just because cars are going to be driving over it, maybe parking. So it is sufficient.
And you do have that detailed on the plan itself.
Yes. So we have it here in the profile, and we do have a detail for it as well here. My computer's kind of slow. Here as well.
And it's show me where it says 18 inches. I'm just being curious. That's all.
Yeah, here.
Oh, there it is. 18 inches minimum. Okay.
Mm-hmm. It also
All
says
right.
in the profile over there to the
Okay.
left.
Okay. All right. I have no further questions. Let's see if anybody in the attendees or the audience, if anybody in the audience has a point of view that they'd like to raise your hand.
That's just our intern.
Got it. Sorry.
Matt's question.
Yeah. Were the abutters notified appropriately by certified mail?
Mm-hmm.
They were. We also spoke to the abutter and we had them connect with the engineer to discuss their concerns. Their concerns about proximity to their system on their side. So Montgomery did meet with them, I think twice. Could you let us know how that went?
Yes, so I spoke to them. So they were basically telling me that there was a time where the owner at 18, they were doing some work on their property. I don't know if they were fixing something, maybe their septic at some point. I don't know. But they did go on his property. They did have access to his property here on the left, and they did damage a portion of their leach field on their side of the property. So he was asking how far is our leach field from his property, and I told him it's right now it's like 12 feet away. So that's enough space. So I don't see. And he did ask if they're gonna be needing access to his property in order to install the system here, the leach field. And I told him no, they shouldn't be needing any access to your property, as we do have this silt barrier here, kind of like showing the limit of work. So they shouldn't be doing any work past this silt barrier. They shouldn't be going into his property. So that's what he was worried about.
And a final question I have, and the Concom has already met on this, or are they waiting for us? Or
They
Oh, we
did.
met
So
yesterday.
they met yesterday. I talked to them this morning. They don't have general issues of where it's being placed overall. There was a question of whether it could be placed in the same spot, and we were kind of replied like, no, that's not really possible. They're more concerned about vegetation and certain tree species.
Yep. No, totally understand that. Okay. Does anybody else have anything before I ask for a motion? Hearing no other questions or comments, a motion, please. Go ahead, Kevin.
I'll make a motion to approve the plan as presented and allow the variance for regulation 27, the fill requirement, and to allow the groundwater offset to be reduced to 3 feet.
I second.
I have a motion and a second. Mr. Baker,
Baker votes yes.
Dr. Wasey,
Matt Wason votes yes.
and the chair, Kevin Davis, votes yes. Okay, Montgomery, you are through the wicket.
Thank you so much.
Enjoy and have a great evening.
Yeah, bye.
See ya. All righty. So let us see what our next item on the agenda is. The next item on the agenda is a discussion of the opiate funds update at 7:10. It's now 7:15, so let's go ahead and start that.
So I wanted to ask permission if we could switch around the agenda and say hello to our special guest in the audience.
Absolutely.
Oh, can't hear you.
Why don't we go ahead and promote Elsie?
Nope, Susan.
Oh, Susan. Oh, okay. Hello, Susan. I still can't hear you, Susan. Still nothing.
How about now?
Now.
Okay, great.
Hello,
Okay, great.
Susan.
Sorry. Hi, everybody. I'm Susan Sama. I'm the new public health nurse working part-time for Littleton and part-time for Acton. Yeah, yay. So my background is I've been a nurse epidemiologist, so I've worked in public health for over 20 years. I've largely been in academia, but I've been on the board of health in Sudbury for about 11 years. So I'm sort of doing a pivot into more local public health. I've always had it sort of a hand in public health, local public health. I was an EMT in Groton when I was younger. And so I was a volunteer on their rescue squad for about 8 years or 10 years. And then since I moved to Sudbury, I've worked on the MRC and then was asked to run for election for the Board of Health. So I've been doing that for a while. So I'm really looking forward to it. I'm enjoying my work so far. We're working on getting some flu clinics set up. So I'm working on that. And we are I'm just trying to figure out some of the projects that I'm working on in Acton. I'm trying to bring over to Littleton also. So like mosquito and tick-borne illness work that we're putting together.
Triple E, yes.
Triple E, I
That'll
know.
be fun.
We just had a positive mosquito today in Massachusetts.
Oh no.
We were going to skirt it because of the drought. Our Triple E carrying mosquitoes were like at 50% of what they've been in the past, but no such luck. So we'll see. It was in the Boston.
Which town was lucky enough to get it?
Yeah, I think it was the Boston area.
Okay.
Yeah. So I don't know. We'll see. But yeah, so I'm looking forward to working with you guys. I know we had a case in Sudbury too, right before the pandemic. Not fun.
Yeah, we got hit with cases around us, and mosquitoes were positive, so we had to kind of have some fun last fall.
Yes.
Hopefully, this fall we won't have those same issues.
Yeah, we had that too. What is good? You guys have a mosquito control program that you're participating in. That makes a huge difference. When we had that in Sudbury, we just started hitting the fields, the vegetation around the field. It really does make a difference. I feel like I know we can't win, right? Either side, whichever way we go.
Right. So the other person that would be very excited to meet you tonight would be Dan. Dan, of course, is at another meeting. He is another fellow lifelong nurse and has been on several boards of health. So I'm sure he would be as excited as Kevin, Matt, and myself are.
Cool.
So welcome to the Board of Health.
Thank you.
Kevin and Matt, if you would like to say something, please.
Yeah.
Thanks. I look forward to meeting you in person and working with you and supporting you however needed.
Okay. Thank you.
Yes. Welcome aboard. I think we've kind of wanted to have somebody in this role for a long time now, and it's great to see it come to fruition. Finally, got our director, got our nurse, and you've already kind of got some stuff going, and you've obviously plugged into the communities around here really well. So you're obviously bringing a wealth of experience to our team, and that is great. So can't wait to meet you in person, and welcome.
Thank you. I'm excited. It's going to be fun. I'm doing a lot of contact tracing too. We got a lot of tick-borne stuff going on. That's the other stuff that too. Yeah, I'm excited. We're going to do some good work.
Fun.
As part of that, Susan, do you want to talk about what we're thinking about doing in the next week or so with the ticks?
Oh, so you mean like doing the tick kits and so we have ordered some tick kits. We've talked about we're working with our intern to put together like maybe a trifold poster. This week I was in the I'm sitting in the senior center, which is actually kind of nice because I'm actually able to interface with the nurse volunteers. So they did they always do blood pressure clinics. So I brought in a bunch of mosquito and tick materials, educational materials, so that they could, so the residents that were coming in to get their blood pressures checked could have access to those materials. So we're thinking about putting together like a poster for that type of stuff, and handing out tickets that have like magnifying glasses, tick tweezers, antiseptic, that kind of stuff. And so we'll talk to the seniors about how to use those materials. And then I also was able to go to the veterans breakfast this morning. So I spent a little time just meeting those guys and talking to them a little bit about what what my role is and what we're doing. And they were really glad to hear that we're going to be doing a vaccine clinic, a flu clinic in the senior center. So typically, I guess you guys have done it in the middle school. In Sudbury, we do that too. But we're going to do one in the senior center and one in the middle school. It's what Francis wants to do, which they were really happy that it was going to be done at the senior center. So that's
yay. That's awesome.
Yeah.
That's awesome.
Francis, did I miss anything? No.
You're good.
Awesome. Well, this is again, very welcome to have you on board. This is amazing. Again, as all of us have said, we can't wait to meet you in person, and thank you so much for your involvement. We really look forward to working with you in the future.
Okay, great. Me too. Thanks for making it possible. I think it's going to be good.
Absolutely. It's what we're supposed to be doing.
Yeah. All right.
All right, Francis, it's back to you now. I'm guessing you're going to give us a report out on the opioid funding.
So we've been exploring the benefit of having pooled resources for our opioid funds. Looking at.
Do we want to put something up on the screen to share so residents can see what's going on?
Sure. I can't pull it. Heidi, would you be able to pull up the packet on share screen?
Yes, just give me one moment to pull it up.
Sure.
I think I can do it I can do it quickly. Hold on one second. Let's see. Am I able to do it? All right. Can everybody see it? Excellent.
All right. So this is a presentation of the opioid settlement survey that we had sent out to residents, asking kind of where they want to see monies being used, what they think are the most significant programming that we need to look at, what kind of programming do they think is the most beneficial, what target groups we should be looking for. So basically, we didn't get much of a response, but the responses we did get essentially pointed toward looking at more of like a social service, looking more towards prevention, kind of focusing on early education, essentially. So we've taken that into consideration, as well as meeting monthly with a regional group of neighboring towns, talk about what their community is looking for and what we're looking for, and trying to like come up with a way to like pool our resources where we might be able to do something significant with enough money each year. The great thing about the settlement funds is it's money to do something, but it's really hard to pull off something in programming consistently on the amount of money we get. So it's enough, but not enough. So that's why I've been looking more at what a regional pooling system would look like. And as we talk more and more, we've kind of understood that maybe some kind of position where there'd be a prevention coordinator, substance abuse specialist type of person that would be able to handle programming and would be able to do all the areas of substance abuse that we need to address. So as part of that, we've met with towns who have already hired this type of person in their community. So we met with 2 other communities who have a coordinator. They talked to us about what they did, what their process was, how it works, and the benefits, best practices, lessons learned. And we've also met with third parties like Riverbend. Seems like a pretty strong leader in the industry of what kind of services a third party contract could bring, if not a person. So we're at a point where we've basically created a position, and now we're at the point where can we support maybe a position? Should we be looking to do an RFP for a third-party service to fill this role? So I just wanted to bring this to the board to review. Obviously, it's going to be months in thought, so I just wanted to bring it early on so we can discuss it now and at future meetings to develop it more.
Okay, so on this page that we have here, the one that I have up showing on the screen is, this is what we're coming to you. What you're asking for is us to consider this. Actually, us to read this and come up with some thoughts and have a future discussion about where the board would like to go with this. Is that what you're at?
That's correct.
Okay. All right. Comments from the board? Matt or Kevin?
Well, obviously we didn't, get the thousands of responses that we would love to get in a survey. It looked like you did get some meat, at least from people who have some experience, which is great. I'd much rather honestly get some of that viewpoint as opposed to too many respondents who say, I have no idea what you're talking about and I don't think there are any problems. So it's nice that you got some direction out of that. And I know it's been a long period of trying to get some information so we can get some direction. So I'm glad that we have what appears to be at least some idea to move forward. One question I have is, in scrolling through there, I saw just the kind of comment of like, why isn't there an AA meeting in town? And while I know these are opioid settlement funds, should we consider the role, and it's not on the screen now, but the opioid abatement coordinator, whatever the role might be called, would it make sense to broaden it to be, instead of pure opioid, to make it just substance or something else, so that it's kind of focused not just on a singular category, which is obviously problematic. I just wouldn't want it to be seen as we're closing the door on other potential issues that could fall under the umbrella, obviously without making the position then too much or too big to handle. So, and I'm sure that's a question also for some of the communities that you want to partner with, to say, could we broaden the scope a hair? And would that still be effective or make sense? So, but obviously the first thing is kind of, are we permitted to do that with funding, or does it have to stay really opioid identified?
Yeah, so the language, obviously, like you pointed out, is a little specific to opioid funds. But, I mean, there's a lot of crossover, and there's a lot of gateway, and there's, so our stance has been that it needs to be a substance abuse person, not just a specific opioid person. So it's looking at the whole issue as a broad category instead of looking specifically at one schedule. Okay,
and I like the fact that the at least the job description has a word abatement. Not my favorite, but I like it better than abuse, because there can be situations where it's not about abuse, but even usage is something that we need to be looking at. So I appreciate that, continue to kind of think about that, of avoiding stigmatous words and try to make sure it's a positively spun thing that we're trying to help our community with. Substance awareness and substance usage and treatment and such. So thank you for that good work, but please keep considering those kinds of twists and angles.
Yep, good thought.
That's what I got. Thanks.
Mr. Baker.
Yeah, thank you for putting all this together. I think it's great, and I look forward to helping to push this forward. I think building awareness about substance abuse is critical and essential and so important to get our youth aware of harms of substance abuse at a young age, and I think it'll help have a positive impact on everybody. So thanks.
I'll pile on to all of that. I think this is a great first draft of what's going to become and have a positive discussion in our following meeting. I think all of these are the right steps forward, and I really can't wait to see what comes of it.
I should also mention that's not in the presentation so right now in terms of funding and pooling, we basically be able to fund a pilot program for about 5 years, where then we could reevaluate maybe in year 3 or 4 and decide whether more funding should be put towards that.
So maybe what we should do as part of this is set up a thing of measures that are used in other substance abuse programs or support programs, and try to come up with some of those measures so that we can evaluate it, not, maybe at the 1 year, the 2 year, and the 3 year, and start to have some sort of decision at the 3 year point that we can start drawing. That would be really good to see, though. That makes sense.
Yeah. I mean, as part of it, we'd have an advisory board essentially through the town. So Board of Health member, probably myself, and then other representatives of the town. We would talk about it, usually probably quarterly.
That'd be great. Okay. Any other feedback? Okay, hearing none, let's check to make sure our audience there's nobody else in the audience besides our intern. And there's nobody else besides our intern. Okay, that's awesome. All right, seeing no other discussion, I guess it is now 7:33, and so it's perfect time for our 7:15 ID discussion support tool. Matt, take it away.
Working on it. All right, here is our current ID support tool update. As we said last time, we're going to keep posting COVID information, but not kind of focus on it too much. Vaccination data, we're now out of vaccination data at the state level, so they actually won't start reporting updated vaccine data till the fall. And curiously, nationwide, the CDC is not getting enough samples of COVID testing to necessarily identify predominant agents by region anymore. So Massachusetts and the New England area is kind of a zone for the CDC. And so they also have not updated those numbers since the last time in June that we met. So it's we'll see how that goes, but they're going to keep reporting nationwide, and we'll see when they update our region, but we'll keep posting it here when we can. As was mentioned, pardon?
Have we heard anything from the Mass DEP? The Department of Public Health, DPH, sorry. Mass DPH, as far as Massachusetts tracking numbers, or is that something that haven't heard yet?
Tracking cases or variant? Or
yes, and yes, all.
Okay, so cases are still reported. This chart is from Massachusetts DPH.
Yeah.
So that is still updated up to 28 June.
Okay.
I'm not sure why that one. I feel like there should be one more data point there or two, but I'd have to go back and look at that data to see if that's just zeros now. The vaccination data is on hold. That's from the state. The wastewater numbers are continuing. That's obviously the 2 wastewater treatment areas outside of Boston.
Yep.
And
what about variants? Are they is the state looking at picking up the variant tracking?
No,
you haven't heard anything.
No, I highly doubt it. If the CDC doesn't think there's enough data from the New England region, I'm not sure what Massachusetts feels there would be value in trying to report state level variants.
Okay.
Yeah, and when I say not enough, I think the CDC wants 300 samples in a 2-week or 4-week period. So if they're not hitting that,
Gotcha.
you're going to be based upon such a small sample size that it might not be worth it.
Yep.
As well as, in all honesty, the last time we saw a variant that we actually kind of looked at more than just a glance, it's been probably 2 years, because we keep getting new variants, and the statement continues to be, oh, it's maybe a little less transmissive. Our vaccine should do a good job. So I think it's kind of not something to spend a whole lot of attention on until we actually have a variant where there's some concern or there's some bigger change that might impact us. So I'll keep including it when we can have the data, but it's not something that I spend a lot of time digging into.
Okay.
Arbovirus, yes. Stole my thunder. We have a EEE positive mosquito sample. It was in someplace west, actually, central, unless there's another one, Susan.
Yeah, you're right. It was Belchertown. That's right.
Okay, there we go. It's Belchertown.
Yeah, it was Belchertown.
Yeah, first mosquito, Belchertown. So Littleton is still considered a low risk, which is one of the lowest level for this is remote risk. Littleton is at low risk. We start every single season at low risk. So that's not something we learned about. And no, we don't have anything close by. West Nile, those cases have been ticking up. They had their first animal test positive for West Nile. Littleton is still low. Fitchburg, Leominster, Air communities have gotten a slightly higher. They're at the moderate risk level, but we're still low, and we'll keep an eye on the West Nile. But no human cases reported at all, and just some mosquito tests.
Yeah, that was a goat in Lunenburg, right, Matt?
Yes.
I think it was a goat in Lunenburg. It's like trivia night.
Yeah, I fell asleep after I saw that one. So we'll keep an eye out. I feel like the mosquito season's very benign in terms of quantities. That's what I've experienced, but I don't know if everybody else has kind of seen the same compared to the last couple of years. So
my daughter, the mosquito magnet, that as she walks outside right now, she has reported that as observational evidence that her mosquito bites are about, the number is about the same as last year.
Okay.
So, but yeah, she walks outside and they instantaneously just run for her. So
yeah. Well, we can add that row to the table if you want. Yeah, your daughter's, objective reporting of bites. Okay, but so the same stuff still. Make sure you're putting some bug spray on, ideally with DEET if you're going out in those evening hours when they're active, and make sure you don't have the standing water pooling around, because we are kind of still in the season where we could see this grow, but right now we're still low. So, and that's what we got.
Excellent. Question for the board. Question, Matt, Kevin, go ahead. Nothing. Okay. Question for everyone. If it gets closer as far as like a bordering town or something like that, I know last year we did some spraying once it got like really close. Do we want to do some preventative spraying in some of the fields as we get closer? What does the board feel about that?
I would ask for our director's recommendation.
There we go.
I think the first step would be, if you allow me to have a conversation with the mosquito control company to find out what our options are in terms of additional spraying. Obviously, the boots on the ground, they're collecting the samples, so
yep.
I can meet with them probably. They're pretty responsive, like next week, and get back to the board on what their thoughts were, and we can discuss it at the next meeting.
I think that would be a great step. Go for it. Go forth, communicate, come back, let us know what our steps are. Let's be prepared for this so that way we know what's kind of going on for next, if it happens. Last year, I felt we were a little on our back heels. We kind of pulled we pulled everything together very quickly, and that was awesome that we did that. But hopefully this year will be, maybe if there's a couple of things that we can do to prepare, I think that would be really awesome.
Yeah, so I mean, the focus this year is going to make sure that we have better communication channels with the public. That was the main result of last year. We were able to respond pretty quickly with the spraying, but luckily we learned a lot last year, and we prepared a lot after the fact last year that we can use this year. So
sounds perfect. All right, let's talk about that at our next meeting.
Sure.
Okay, awesome. Okay, let's see what's on our agenda, unless somebody has something else that they'd like to talk about really quickly. Seeing nothing, hearing nothing.
The only thing that's not on the agenda, but I put it in the packet, is the impact of 550 King.
Oh, sure. We can talk about that in administrative matters. That'll impact the director and the board and everything inside. So that would be great. So why don't we go to that as an administrative item? Okay.
So a couple years ago, an impact report was done, I think, between departments by Lupoli Construction, assessing what the cost and benefit and how much work, additional work we put on the town departments if the development was actually fully developed. It does not look like the health department was originally included, Board of Health. In that impact, recently the town administrator's office asked for an update from departments on what they think that would be. So this would be our first submission. This is the details in the packet of what I laid out would be the impact. As you can see, there's quite a lot there. I took a lot of consideration in thinking what that kind of would mean. And essentially at the end of the day, you'd be looking at another full-time person to be able to address all the concerns in there with minimal revenue.
Okay. Okay. Looking at that, what are the yearly impacts? I see a staffing impact, and then I see current proposed use and analysis. What are the yearly impacts or quarterly impacts that we would have?
I mean, it's kind of hard to say depending on the rate of construction and depending on how organized Lupoli is versus industries that want to move in, people that want to move in. It's kind of hard to guess what the foot traffic will be for contractors, subcontractors, companies interested in moving in but not sure if they want to, so they go to us first. Residential questions can keep coming up. There'll be a lot of affordable housing questions. There'll be a lot of certificate of inspection questions. So depending on the speed they move, it could increase in volume dramatically really quick, or it could be over time. The schedule for development seems to change a little bit each time they are asked, so it's kind of hard to say for sure. But I would say within year 2 from now, we're looking at a significant amount of increased foot traffic.
Okay. Questions from the board? Matt or Kevin?
If I may, Francis, one of the things that would help me, especially as you're talking about the staffing impact, is percentage change for current. Basically, so 1,089 residential units, correct? Like, not everybody has a concept of what that could mean. So how many residential units do we have right now, knowing that a lot of them don't cause you a lot of regular trouble, and you get a handful of issues kind of out of a year. I know you pointed out in here that maybe the quantity of issues coming out of this type of residential unit could be higher than what we experience in this community at a baseline. But still, to be able to say this is a X percentage increase over the number of residential units we have in town. Same thing, restaurants. We're going to have an expectation that there are this many more restaurants. I think you called out what 10 to 15. We think just ballpark. You know, what percentage increase is that on our existing, and then the kind of the shops and other things that are, you know, one last category, as well as the hotel. That, I think that would help me and also help potentially other folks in town as you start to talk about necessary funding, because we are effectively, you know, doubling the number of hotels and pools that we have, right? or increasing our number of restaurants by 10, 15%, whatever that might look like, might help sell those impacts a little bit.
It's good now.
And then I hear you. It's going to be hard to figure out the timeline, and so I think you also just have to say, you know, unfortunately, this is what we think it's going to be at the end when the whole project's done. But it might actually be easier in the end because things will be kind of more in a stable position, and you're not going to be asked to do as much, as opposed to that build-up time, which actually could be a larger impact on your time and energy. So,
I would say, piggybacking onto that, I would say there's probably a higher impact as things get built up, and then, you get to that steady state where, there's more restaurant inspections, and like you said, there might be some nuisance odor issues or other things that go on with the living conditions and things like that, but it kind of will settle out. So the question is there a temporary staffing impact that we could do early on to get somebody to come in temporarily help you, and then while we look to do, assess the impact in years 2 or 3 or something like that. Kevin, anything?
Francis, do you have an indication if those are going to be 1,089 rental units or units for sale?
I believe they're for sale units.
Okay.
There will be some rental, I think, built into it to a certain percentage, I would think. They didn't really specify, so I just used my best estimates.
Because if they're rental, just every year, the paperwork just keeps coming, especially on the affordability end of things. I'm sure there's a bunch of boxes that have to get checked by the Board of Health. So just to keep that in mind, that, it's not going to be just a one-time effort.
Yeah, Kevin, if I can add on to that before you continue, that's a good question to ask. Is there anything in the project planning or anything that the town can do in order to actually cap the number of rentals it could be? Because that might be totally out of our control. Somebody could buy up a bunch of them, turn them into rentals, but that, like you point out, could have a much bigger impact.
Yeah, I can ask the planning department. I think that's probably the first place to look.
Is there also going to be over 55 housing in this as well? Was it a mix? Is there a mix of style units that are going to be going into this as well?
I don't really know those details. I imagine planning would know that too, so I can just make a list.
Okay. Sorry.
Well, thank you for throwing our name in the hat as the Department of Health to have some input on the impact study. I appreciate you taking the reins on that. That's great.
Thank you.
Anything else from the board? All right. Our next agenda, as far as administrative matters, are there any other administrative matters that we'd like to bring? Francis.
As Susan mentioned, we're going for the clinics now. Susan's been a great help in trying to connect with the pharmacy and getting those dates hashed out. We're looking at one at the end of September in the senior center. I think that'll be a really good clinic. And then the second one we'll still do at the middle school just to bring in all ages. It will be flu and COVID. We gave the numbers from the past couple of years to the pharmacy so they have an idea of what to look for. And right now we're just looking at a sign-up system that will work for everybody. As usual, the CERT team will be able to assist with workflow in the clinic. So that'd be great. And we'll have Susan running around. That'd be nice. So I think it'll go really well this year. I thought we did pretty good last year. We actually did recently have the Nantucket Health Department call us because they said that we were one of the few towns who had a spike in vaccinations last year. So they want to know how we did that. And obviously I told them that that's when I was hired. So yeah. So we just talked. Yeah. We just talked about, how to get the message out there and the different ways that we did it and how we kind of promoted it more and put it up everywhere. So we just tried to help them assist in how they could do it better next time. And we provide some materials that we use for our clinic so they can kind of replicate it.
Did they need any members of the board to fly out to Nantucket for a junket to, interact with that board or?
Yeah, I got your plane tickets here.
I think it was the chair at the time. Actually.
Oh, is that what it was? Oh, that's what it was. Sorry. We'll send the Kevins. We'll go up to Nantucket. We'll interface and we'll bring Francis along. Make it a whole big trip. It'll be great.
It's a retreat. Yeah.
A retreat. That'd be perfect. Perfect. All right. Well, that's awesome
Um,
news.
Yeah, as Susan mentioned, next week we're probably gonna send out a press release for the tickets, giving tick education because this is the worst time of year. The tickets are pretty cool for the amount they cost. It wasn't too bad. We're gonna start with 100, see how popular they are. So we'll have a baggie that will include educational materials along with the kit that our intern will be helping with. I think it'll be a really cool promotion, and we're gonna do it in conjunction with the senior center, so probably get more attention on it.
What
That's awesome.
options do people have for tick testing?
Right now, we don't have any real options that we can point them to. They can get tested in a private lab, but
Yeah, so I think UMass Amherst has, they still have their lab for, you mean for testing ticks themselves?
Right.
Yeah, I think that UMass Amherst still has testing available, but the state's really not doing it for residents anymore.
Yeah.
yeah, like 10 years ago, it was a lot better.
Yeah.
That's what I figured, but it'd be nice if the kid at least included that for people who are interested to say, if you do have one, apologies, the town doesn't do anything. You'll need to find a public provider to do that, or if the university is doing something, like if we can include that. But I didn't expect a great solution there. Okay.
And I must say, some of the nastier tick-borne illnesses are tricky. My brother-in-law got one of those really nasty ones, and it took him about 3 weeks to figure out which one it was.
Yeah,
Definitely.
we're seeing, I feel like I'm calling multiple people a week with babesiosis and anaplasmosis. And babesiosis is similar to like the parasite that causes malaria, and you can get really, really sick. And so ticks, they're finding that ticks only have to be on you for a short period of time to transmit those more severe, diseases like anaplasmosis and babesiosis. And I don't know, I feel like a prompt diagnosis is really important because things can go sideways with those diseases. So we'll see. And, the other thing I'm seeing is co-infections. Like people, they'll come into my, the database, the Maven database with one, and then a couple of days later, they come back in because they've gotten diagnosed with multiple. And I mean, this is new to me. I haven't done contact tracing before in this capacity, but I don't know. That's a drag. So.
Awesome. Okay. Also, are we in the tick packets? Are we also educating? Is there education in there how to remove the ticks, the proper way to remove them, and things like that? Okay. Good. Excellent. Excellent. All righty. Any other admin funness?
It's as fun as it gets.
Okay, elephant in the room, since we had a discussion in the last meeting about administrative support. Email was sent, nothing was heard back. I'm assuming, hi Heidi. I'm assuming Heidi is our admin taking copious notes this evening of everything that's going on. So thank you, Heidi, for that. Anything else heard from?
Right now it is ongoing. Heidi will be filling in the interim, and she's been doing a great job with that. Learning a lot of new fun things about public health. I'm sure she didn't want to know.
Oh, awesome.
Yeah. Obviously, we're advocating for the same level of support that we had before, no matter what kind of structure is in place. So until we see something concrete in writing, there's not much to say either way.
I think as a board, I think what we ought to do is, if we don't hear something by the September timeframe, is definitely to reach back out again and say, hey, what's going on with this, and seeing what we kind of come back with. So we wouldn't mind putting it on as an agenda reminder in the September timeframe. That would be great. Yes, Kevin.
We might want to consider getting on the agenda for a select board meeting.
I've reached out to Mark, and he let me know that we should be working within the town administrator. But I agree, we should definitely be working with the select board itself and trying to figure out what's going on there.
Sorry, could you clarify that? He said that we needed to be working with the town administrator on this particular issue?
Yes, he said go back to the town administrator, write your well thought out email, and then we'll go back to him. The only reason why I reached out to Mark is he's our Board of Health interface to the select board. So I figured I could skip that level and talk directly to him. So, but I agree with you, Kevin. I think we definitely should have some sort of thing. Matt, I can tell your faces. There's an
Well, the select board was just asking us to meet with them more regularly and talk about problems so that they're not caught off guard. And it feels like this is a classic thing that should be taken to them, but that's fine. I guess this isn't the first time that we kind of don't get the responses we're looking for. So you said September and I bristle at that. If we're not getting a response to a question that we send to the town administration office, then that's just not okay.
Okay. So
I think sending out one more email to say, like, what's the answer? What's the solution? We need to be fully informed. And if we're not getting fully informed, then yeah, we need to be talking to the select board because that's who the town administrator reports to and made it abundantly clear to us. So.
Sure. Okay. I will wait. I guess what I'll do is I'll wait till next week or the week after and see if I get something. If I don't get something by Wednesday or Friday of the following week, then I'll send out something again on the following Monday. So a week from this coming Monday, I'll send something out again. Say, hey, we still haven't got an answer. And see what happens with that. I'm actually going after his statistics. He said that he measured the efficiency and saw some efficiency gains, and that's the reason why we can do this. So I'm asking him for his statistics and his numbers for where he got his efficiencies from. I haven't heard anything yet. Okay. Keeping it above board. Any other administrative items? All right, in our packet also, we have the June 25th meeting minutes. We have everybody here that can vote on it. Has everybody had a moment to review? Yes, Kevin.
I'd like to make a motion to approve the minutes as presented.
I have a motion. Discussion.
No second.
Your second?
No second. I'm not saying second.
Okay. Okay, what's going on?
Francis, you wrote these, right?
Sorry, yes.
Okay, I just want to make sure I was saying it's the right person. The only thing was just a clarification on the section where we were talking about the fee schedule. Third paragraph under Public Hearing Board of Health fee schedule review were my comments about reinspection. And the only thing I wanted to call out is maybe could we add that I inquired about the current process for restaurant reinspection just to make the rest of that sound clear to people so they don't think I'm talking about septic plan, reinspection, whatever else it might be.
Yeah, okay.
That was really specific about restaurants.
That makes sense. Okay.
Otherwise, that's all I would have pointed out.
I'll withdraw my motion. Motion withdrawn. I'd like to make a motion to approve the minutes with the update to said paragraph Dr. Wason pointed out, including the word restaurants.
I'll second.
Motion and a second. I'll take a roll call vote. Mr. Baker.
Your vote's yes.
Mr. Wason.
Wason votes yes.
And the chair, Kevin Davis, votes yes. We have our meeting minutes for that taken care of. That is awesome. All right. And then...
Sorry, before I forget on that.
Yes, sir.
The property in the minutes that we're trying to do that deck reconstruction that was going to be too close, they were going to come back in the next meeting, but our last meeting got canceled. I just want to make sure they didn't fall off our radar, Francis. They just haven't come back to us?
Yeah.
Oh, okay.
I was going to say, I didn't see them on the agenda, so I'm assuming they just didn't come back to us.
Not yet.
Okay.
Okay. Well, let's hope they come back because we gave a pretty creative answer to their issue. Okay. Board member updates. Mr. Baker.
Currently have no updates.
No updates. Excellent. Dr. Wason, any update?
Oh, it's fine. Matt's fine. It's okay.
Fine, Matt.
Francis, there was an email chain with some of us. Can you give an update about your plan for air quality concerns around the quarry?
Sure. So we received a complaint about dust nuisance from the quarry and contents of the dust from a concerned resident. We had originally tried to inquire with DEP about what kind of controls are happening and if they can come out on site with us to walk the site and review. We did not get a very good response to that. So by the end of the summer and winter hit pretty quickly after that, so it really wasn't something that we could look at during the winter. Now as we hit the hot weather and dust is more potential, we received inquiry for an update. So as part of this process, we did meet with the Westford Health Department a little while ago and talked to them about, because they had a site in town that did receive attention by DEP because of their department. And I asked what kind of methods they used, how they did it, and what's required to get that level of attention. So they did talk to us at length about how they did that. So we'd be proposing to do a similar approach and trying to get the same response.
If I may ask you to maybe on your side, if you don't have it already, start keeping track of a timeline of all of this. And it obviously predates you, but these complaints are not new. They've been going on for years. And if you can't find records of them, I know at least Dan Kane, our board member, would have some email records that he could also forward to you of the historical stuff. But I'm assuming he's not the only person. I don't know where reports would have gone 2 years ago. I have no idea what that would look like, or if they were emailed that you would have access to. But just knowing that this isn't new, this didn't just start. But also in that timeline, I believe we tried to reach out during the winter when stuff was not covered in snow or covered in another way, and that was still not supposed to be the right way of dealing with it. So I know your kind of comments are, we need a lot of volume to help push our case and get some attention, but I think those all should contribute to the volume that we're collecting. And then honestly, if it's volume we're worried about, do we need to actually hate to like be proactive and ask people to complain, but do we need to be proactive and ask for people's opinions on it or something? Saying, are you experiencing any sort of air pollutant nuisance? Please report it to us.
Well, so we don't have any files. You are correct. That's not overly surprising. As we kind of I pointed out in the email, like I would encourage anybody who has a concern for it to reach out. I don't know, I wouldn't post anything, but I mean, neighbors do talk and they have to share their same concerns. So if that's the case, if we could get people together and find out more about that, that'd be helpful. Because right now, I only have one person to go off of. So
have we opened up a case in our electronic records management system so that we can start tracking and we can start adding previous data that we may collect over time to it as like an information gathering piece?
We have not. We just have notes, but we can do that.
Okay. All right. So it's pretty localized to the, this side of town. And I also noticed that we do have one of the Purple Air pieces a little bit farther down from the quarry, and I know the resident also purchased one as well and registered it on there. The particulate on that should be picked up? Question mark.
It might not be.
Okay. All right. So that particulate, okay. Or it might be a daily spike or something like that after they do
Blasting,
blasting or something like that. It would be a spike in that area. Okay. Okay. Thank you. Anything else, Matt? I have no other correspondence. No one else reached out to me to speak specifically about any other items. So that's what's going on from me. And it looks like Elsie is still the only person in the public viewing area. So no other public. Does anybody else have anything else they'd like to discuss?
Just briefly, Westford Health Department reached out. They asked if we'd be looking to share any services with them. So we're exploring what that might look like.
Awesome. Continue exploring. Report back when you have something fun. I'm just not anything.
It's all fun. Yeah.
Well, health people would say it's all fun and games until you poke, but we won't go there. All right. Looks like we are done, and our person who usually does the motion isn't here tonight. So, Mr. Baker.
I would like to make a motion to adjourn.
I have a motion to adjourn. Do I have a second?
I will second.
Second and a motion. I'll do a roll call vote. Mr. Baker.
Kevin Baker votes yes.
Matt.
Matt Wason votes yes.
Kevin Davis votes yes. The Board of Health meeting for July 23rd has concluded at 8:07 p.m. Woo!